12 Unusual Symptoms of Diabetes. Hello, welcome to the Health Life YouTube channel. Diabetes is a chronic disease that can cause many health consequences such as stroke, kidney disease, blindness, etc., if not well controlled. Therefore, recognizing common and unusual symptoms of diabetes will help patients take corrective measures and prevent serious complications of diabetes early. 1. Diabetes at a glance. Diabetes is a condition in which the body does not produce insulin, type 1 diabetes, or does not use insulin properly, type 2 diabetes. Both types of diabetes lead to elevated glucose or blood sugar levels. According to research, insulin acts as a hormone to help regulate the amount of glucose in the blood, which is normally produced by the pancreas. In addition, insulin also helps the body use sugar from carbohydrates to create the necessary energy source. If there is a lack of insulin, glucose cannot move into cells. Instead, it will accumulate in the blood. Diabetes is a chronic progressive disease. Therefore, being aware of the main symptoms is an important key to helping you maintain healthy blood sugar levels, while preventing the risk of diabetes complications. The initial symptoms of diabetes are not the same in all patients. Some patients have recognizable symptoms, while others experience rare symptoms. 2. Spot 12 Unusual Symptoms of Diabetes. To help you prevent future consequences of diabetes, let's quickly recognize 12 symptoms that can occur when developing diabetes. Specifically, 1. Skin becomes darker. One of the most common warning signs of diabetes is the unusual development of dark patches on the skin, especially around the neck. Dark patches tend to be widespread or noticeable in wrinkles on the skin. The skin around the neck may also become thicker and darker. This phenomenon is called acanthosis nigricans, AN, and it sometimes also appears in the armpit and groin areas. Acanthosis nigricans is a common type 2 diabetes complication and occurs more often in patients with darker skin. Dark hyperpigmentation on the skin often appears when the amount of insulin in the blood increases and accelerates the production of skin cells faster than normal. 2 recurrent infections. With diabetes, the immune system also becomes weakened and makes the patient more susceptible to health problems. One of the consequences of diabetes is recurring infections, including yeast infection, vaginal infections, skin infections, bladder infection. When measuring diabetes and seeing a high blood sugar index, this proves that white blood cells are having difficulty moving in the blood. This is considered to be the cause of reducing the body's ability to fight infections. 3 changes in vision. Another unusual symptom of diabetes is changes in vision. High blood sugar levels can have major effects on all parts of the body, including vision. When the blood sugar index increases, it will change the amount of fluid in the eyes, leading to swelling, blurred vision, or difficulty focusing on objects. 4. Feeling dizzy or lightheaded. People with diabetes are also susceptible to feeling dizzy or lightheaded due to low blood sugar. If diabetes is measured and the index is high, the patient may experience symptoms of dizziness. High blood sugar levels are also a factor that causes patients to urinate more often, which can easily lead to dehydration. When the body does not have enough water, it will negatively affect brain function, causing patients to easily lose concentration and lose memory. 5. Sexual dysfunction. Erectile dysfunction is a symptom and also a common type 2 diabetes complication in men. This condition can make it difficult for men to achieve an erection during sex. In general, this problem of sexual dysfunction often occurs when high blood sugar levels damage the nerves as well as the blood vessels that carry blood to the penis. When suffering from erectile dysfunction, men with diabetes are also susceptible to physiological weakness or reduced sexual desire. In addition, Sexual dysfunction can also appear in women with diabetes. Unstable blood sugar index makes it easy for women to experience vaginal dryness due to less lubrication. This also contributes to pain and reduced pleasure for women during sex, leading to frigidity and loss of interest in sex over time. 6. Mood changes. Frequent irritability or mood changes are another unusual symptom of diabetes. This condition occurs because diabetes is not well controlled and leads to sudden changes in blood sugar levels. According to experts, blood sugar is a factor that contributes to rapid changes in a patient's mood. Therefore, when measuring diabetes and noticing a blood sugar index that is lower or higher than normal, it can warn of changes in your feeling or mood. However, these feelings are only temporary and may disappear when blood sugar levels return to a stable level. 7. Abnormal weight loss. When the body does not use insulin properly or cannot produce this hormone, it will make the process of providing glucose for energy used to cells difficult. As a result, the body begins to switch to burning fat as well as muscle mass for energy, thereby leading to a sudden loss of body weight. 8. Itchy feeling on the skin. High blood sugar levels can damage nerve fibers running throughout the body. These lesions can occur in any area, especially the nerves in the hands, feet. At that time, the patient will have extremely uncomfortable itchy symptoms on the skin. In addition, damage to blood vessels due to high blood sugar also reduces blood flow to the limbs. This can cause symptoms such as dry skin, itching, and peeling. 9. Fruity breath. Fruity breath is another less common symptom of diabetes, a condition also known as diabetic ketoacidosis. When the body doesn't use insulin for the energy it needs, it breaks down fat cells for energy. This process creates an acid, specifically a ketone. Excess ketones in the blood are usually excreted from the body through urine. However, when the body begins to break down fat for energy, this can lead to fruity, ketone, or nail polish smell on the breath. In general, ketoacidosis is a serious diabetes complication. Patients need to see a doctor early if they experience symptoms of this condition. 10. Leg or arm pain. A high blood sugar reading after a diabetic test can lead to diabetic neuropathy and develop symptoms such as arm-leg pain or cramps. Pain from nerve damage often appears mainly in the legs, arms, hands, or feet. Sometimes, patients also have a burning sensation, tingling and numbness in their limbs. 11. Dry mouth. Dry mouth can be another symptom of diabetes. High blood sugar levels reduce saliva flow, which increases the risk of developing gum disease and tooth decay. Dry mouth can continue even after a person is diagnosed with diabetes. In addition, dry mouth is also a common side effect when using some diabetes medications. 12. Nausea. Nausea and vomiting are other manifestations of diabetes, which can occur due to neuropathy. Nerve damage prevents the body from properly performing its normal functions of moving food from the stomach to the intestines. When this process is interrupted, food will reflux in the stomach, leading to feelings of nausea or even vomiting. Some other symptoms are more common with diabetes. In addition to recognizing the unusual symptoms of diabetes, you also need to pay attention to some of the more common signs to detect the disease early. These symptoms are usually mainly related to the improper use of insulin by the body, including increased frequency of urination, frequent thirst, extreme hunger. There are slow healing sores. When do diabetics need to see a doctor? When do diabetics need to see a doctor? Currently, there is no cure for diabetes. However, this chronic health problem can be effectively managed through a suitable treatment plan. If not detected and treated early, the patient may experience the following diabetes complications: blindness, nerve damage cannot be repaired, skin complications, amputation of 4 limbs, stroke. Kidney disease, dead. If you have recently noticed yourself having any symptoms that suggest diabetes, such as itchy skin, blurred vision, increased frequency of urination, etc., take the initiative to see your doctor as soon as possible. Through random blood glucose tests, timed diabetes measurements, fasting blood sugar tests, or A1C tests can help doctors diagnose diabetes. Once diagnosed, a patient's treatment regimen may include oral medications, insulin, exercise, and other dietary changes.